Hello, and welcome to Patient and Family Care Study. My name is Afame J. Charles Jr., and I work with St. Carol's Club Nursing. So we have assessed the patient, we have analyzed the data, identified health problems, generated nursing diagnosis, and planned care for the patient. After planning the care, we have intervened, and now in Model 5, we are going to look at evaluation. So Model 5 tackles evaluation of nursing care rendered. We are going to evaluate the care that has been done for the patient. So Model 5 comprises of evaluation of care rendered to the patient and family, statement of evaluation, amendment of nursing care plan for partially met or unmet outcome criteria, termination of care, summary and conclusion, bibliography, and signatories. So, to start with evaluation, this is where the final judgment is placed on the outcome of care. So you have identified health problems, you have generated nursing diagnosis, you have written down your nursing orders, intervened, and now you are going to find out whether these goals or these objectives were met fully, partially, or unmet. So it includes conclusions drawn by the nurse and patient on whether the care has been effective in meeting the set objectives. We have looked at this under Chapter 3 or Model 3, where we looked at evaluation as part of the nursing care plan. So this is just a recap of what we did under Model 3. So with the statement of evaluation, you state the extent to which pre-established goals have been obtained by the patient. So we are trying to see whether the pre-established goals have been attained by the patient. So you set some goals, you have some measurabilities, and we want to find out whether these measurabilities or these goals have been met. So this should be a statement that corresponds to the evaluation in the care plan. Yeah. So to do this, the patient is reassessed in relation to the first assessment. Then the care is compared with the problems identified and planned. So you reassess to find out whether to compare the care to the problem identified, whether the care or the problem identified, the nursing orders interventions are tailored to solve the problem. We are looking at that. Then patient's responses will then be compared with patient's previous condition to determine any change in the patient's health status. So, for example, when a patient tells you that he's in pain, you have an order which says evaluate the level or assess the level of his pain. Then you know that pain is subjective, and patient can tell you that his pain or her pain is rated at 9 or say 10 out of 10. Then after you have intervened and your nursing orders, you can now reevaluate to ask patient what his or her pain level is, and then patient can tell you that now the pain level is at, let's say, 2 or 3 or 1. That's evaluation. But under your measurability or under your set objective, you state that within patient's pain will subside as evidenced by patient's recording pain level of, let's say, 2 or 1. Then when patient meets that, then you can say this is fully met, the objective is fully met. So that is what I mean by you going to evaluate patient's responses and compare them with patient's previous condition. So the responses will then be compared with set objectives to see whether they have been met. So you compare them with set objectives as well. An evaluation is drawn by stating whether the objectives are fully met, partially met, or not met. So we look at all these three. If the goals are met or achieved, care is terminated. However, if the goals are unmet or unachieved or partially met or unachieved, then the objectives and care will be modified or amended to continue for another period. In chapter 3, we looked at and we briefly talked about amendment of care, but in model 5, we'll look comprehensively about amendment of care. Then evaluation is written in the past tense. Therefore, the measurability statements of the objectives and outcome criteria are written as such. So when writing the evaluation, let's say you have a set of objectives to say that patient's pain will subside within 5 days as evidenced by patient verbalizing reduction of pain. Then in evaluating, you say that goal fully met as patient verbalized a reduction in his pain. Then it's in the past tense. So these are some examples of evaluation statements. So goal partially met as respiratory rate was recorded as, so recorded making past tense, as 25 to 30 cycles per minute, and patient said he felt slightly better. And goal fully met as patient's fluid volume was maintained throughout hospitalization. Goal not met as patient wound did not heal by first intention. These are evaluation statements, and they are all in the past tense. Then we move to amendment of care. So amendment of nursing care. So this is necessary when the patient has made little or no progress towards goal achievement. So let's say you have drawn or you've set some objectives to solve a goal or to solve a problem, and now you have to evaluate, and at the end of your evaluation you realize that the patient's goal was partially met or unmet. Then you have to do an amendment of care. So when care is amended, you state the reason for amendment and include the amendment care plan in this section. So on the previous slide, you saw that a patient can have a wound, and the measurability will be wound will heal by first intention. And at the end of the care plan, when you evaluate and you realize that the wound did not heal by first intention, then we have to amend care and draw a new care plan to suit the wound care or to maintain patient's skin integrity. So with amendment of care, it still also follows the same procedure. You would have to redo the care plan, stating the date and time, the nursing diagnosis, the objective and outcome criteria, the nursing orders, the nursing intervention, date and time for evaluation statement itself, and signatures. Then we move to termination of care. Termination of care is when you end, the nurse-patient relationship comes to an end. In nursing care, we have what we call establishing of rapport, and to gain the patient's trust and respect, you have to establish these rapports to help you care better for the patient. So you have this bond or this good relationship with the patient, which has to come to an end because patient has been discharged, because patient is now doing better, or because patient is no more under your care. So the relationship between the nurse and the patient is an important one, and it is built on mutual trust and respect, and serves as a foundation for optimal patient outcome. Once the nurse-patient relationship is established, patient care is expected to continue until such time as care is terminated by either the nurse or the patient. So the patient can decide that he or she wants to terminate care with a particular nurse because of what you might have done or how you might have treated him or her. So it's not just the nurse who terminates care. Patients can also terminate care. So when the relationship becomes compromised, terminating the care of the patient may be necessary. However, terminating a patient from your care should never be an easy decision or taken lightly. Most of us now find it easier to terminate care with patients, but most of the time it depends on the rapport or the relationship you have built with a said patient. And if you have that strong bond with that patient, it will never be an easy decision and you will never take it lightly. So termination of care then becomes a difficult task, right, more than any other task you'd have to take. in your write-up. It is important to follow a series of steps when terminating the care of the patient to avoid negligence of duty and patient abandonment. So that is why we start at the beginning. Termination of care is introduced to the patient right at the beginning of the day of admission. And the patient is aware that he or she, the nurse, would definitely terminate care. So the patient must be given sufficient or reasonable notice that care will be terminated. Usually the patient is informed on the day of admission. So the patient will be told on the day of admission that, hey, your stay here is temporal and you would recover. So your termination of care will be definitely done. Then we terminate care. So to continue, ensuring continuity of care during termination is by handing over the patient to the public health nurse, which we have looked at in Model 4, Chapters 4, and referring or recommending a health facility to the patient. Termination of care is done after the last or third home visit. We normally do termination of care at the end of the. Previously, under Chapters 4, we looked at ensuring continuity of care, and we do this by handing over the patient to a public health nurse or referring or recommending a health facility to the patient. So this is done to, as I said, to ensure continuity of care, to make sure that the patient is in good hands and the patient will not relapse. So termination of care is done after the last or third home visit. So after the third and final home visit, we terminate care, let the patient know that he will be handed over to a public health nurse, or you recommend a nearby hospital where the patient can seek care if the need be. So moving on to summary. Under summary states the summary of the care rendered to the patient and family from the time of admission till discharge, or if he or she leaves the ward or dies. So you state a summary on all that. Then under summary should consist of the date and time of admission, the number of days the patient spent on the ward, the chief complaint of the patient upon admission, laboratory investigations and diagnostic investigations requested and done, the medications used to treat the patient, and surgeries, if any, problems identified, vital signs throughout hospitalization in ranges, number of home visiting done, and date of termination of care. These are all parts of the summary. Normally the summary takes about a page, and you should have all these details and more on it. So moving on to conclusion. Under conclusion, you state the conclusion you have made from the patient and family case study. So what benefits the case study has brought you, how the case study has helped you as a student nurse. Then with this, you make recommendations to your training institution or school, the Nursing and Midwifery Council of Ghana, the Ghana Health Service, and the Ministry of Health to better the patient and family care study or other write-ups. Finally, we move on to bibliography. Under bibliography is what is referred to as references in research work. So you state alphabetically all the literature you used as reference materials for writing patient and family care study. So it's the same, you follow the APA format in research methods. So it should contain the author, the year of publication, the title, edition, the place of publication, and the publisher. So these are examples. So clinical team, IC 2014. So clinical team, IC is the author. 2014 is the year. Gallstone disease, diagnosis and management of cholelithiasis is the title. Then clinical guidelines, but this one doesn't have the publishing or the where it was published, I should say. Then this is another book, Nursing Drug Handbook, which was written by Clover in the year 2010. The edition is the 29th edition in 2010, and it was written in Philadelphia. It's a drug book for your pharmacology of drugs. There's another book here, which you mostly know, Vuna and Sadat. It's a popular textbook. It's a 12th edition, written by Susan C.V. and the year 2010. And I should think there are more latest editions. So in doing this, you have to check if you are using the latest edition. And you also have another reference or bibliography, which is the patient's folder. And another one which you definitely use, which is NANDA. NANDA 2018. NANDA is a North American Nursing Diagnosis Association. They have a manual which you use for the care plan or the nursing diagnosis. So we've come to the end, but before that you have to talk about signatories. And with the signatories you have to sign yourself. Your clinical instructor has to sign. The clinical instructor in the hospital has to sign. Your institutional instructor has to also sign. Then your head of department or head of school or principal, if you like, will also sign. And that comes to the end of chapters 5, which is on chapter 6, and or not model 6, I should say. And model 6 talks about how to write the case study or how to do the write-up. So thank you for your attention. My name remains Afam A.J. Charles Jr., and I've been taking you for patient and family care study. Thank you for your attention.